Welcome to Leadership Forward, where you'll meet Arizonans with innovative answers to our state's greatest challenges. I'm Dawn Wallace from the Arizona Center for Civic Leadership at the Flinn Foundation. Welcome to Leadership Forward, and today we're going to be road tripping through Arizona's digital highways with not just one, but two Flinn-Brown Fellows who are leading conversations across the state on a plan that addresses all of the gaps we have in broadband accessibility with a focus on empowering communities and fostering economic growth. So let's start with our first guest, Dr. Erin Carr-Jordan, the president and CEO of Digital Equity Institute and the executive director of the Digital Equity and Social Impact at ASU. Throughout her career, she has been known as a tireless advocate of children's issues, including their health, their safety, their well-being. And by her own words, she is a mountain mover and the only person I know who's been banned from McDonald's. And as a mother, I have mad respect. Having spent a great deal of my child's childhood in those types of establishments. Our next guest is the president of the Arizona Regional Economic Development Foundation and board president of Aerospace Arizona, and was most recently named as a member of the Arizona-Mexico Commission. She has been called a champion for rural communities. She's Tombstone's own Mignonne Hollis. So let's welcome you both. First question I have for both of you is, why don't you just have one job? Like most of us just have one job. You all, if you go on your LinkedIn, have like 7 each.
My kids ask me that same question.
Do they?
They do.
Yeah. I get asked that. How much more are you going to do?
Yeah.
There's so much to do, though.
There's so
much to do.
So much to do.
And that's why you're Flinn-Brown Fellows.
Yeah. Right?
2013 Flinn-Brown Fellows, as a matter of fact.
Hey.
Were you in the same class?
Yes, we were.
How cool is that? And
Very
now
close.
you are working together a decade later
Yeah.
on very important issues impacting our state. And that's how we all communicate and how we access information, healthcare, education, all of those good things. So we're going to be talking about our state's broadband infrastructure today. And there's a lot of really exciting things happening, certainly with new federal funds coming in that are going to create sort of a more comprehensive, cohesive plan around broadband. But also the fact that, unfortunately, we just went through a pandemic where everything was exposed in a really, really kind of cruel way, right? In the throes of just probably one of the worst parts of our, recent history, we saw all of those inequities in terms of what people had access to. So before we kind of get into the nitty-gritty, I want to set sort of the stage. Where are we as a state in terms of our broadband accessibility? Where are we in terms of coverage, speed, technology? I'll ask both of you, since you both have, sort of different communities in which you can speak to urban, rural.
I love that question. And the actual answer is we don't know. What is reported, the data that are available tell us a certain story, but we know that those data aren't necessarily completely accurate. And so somewhere in the neighborhood of under 1 million, but more than 500,000 people still lack access. And those folks exist all across the valley and into our rural areas, our remote spaces, and certainly across our tribal lands.
Well, so a recent ACA report says, and that's maybe where the data may not be exactly, but that we have 400,000 households that don't have access to internet in the state. Now, about 800,000 of them have the most minimal speed, not at a point where anything could be downloaded and it's all wired for them. And that of that, 900,000 of our households only have access to one internet provider, which has its own issues, right? Because if you put all your eggs in one basket, that basket
lacks competition.
Yeah.
Well, and it's even more than that, though, Dawn. If there's one, it doesn't mean that one is working.
Right.
And it doesn't mean that one is going to stay.
Right.
So you could have one provider in an area, only one, and that provider is on their way out, which is a fact.
Has that happened?
Oh, yes. Mm-hmm. Happening right now.
Where you have an established provider in a community.
So
and
we can just talk about my mother here.
All right.
Okay.
Let's talk about your mom, Mignonne.
So my mom, she's 85, doesn't really understand how any of the internet things work at all. Got a letter from CenturyLink saying, we no longer provide internet to your home. So she doesn't know what that means. Like, what does that mean to me? And out in her area, because she just lives a few minutes from me, so still in a very rural part of the community, of Arizona, Lumen is coming in. Mm-hmm. But in the meantime, what is the person supposed to do? And so this is why we say we know for fact that if you have that one provider and no one else will come in, so we called Cox, we called Clark Information Systems, which is a smaller provider in our community, and none of them have any of the infrastructure to service her. So one provider, but that provider's going away because in Cochise County, as we all know, has the highest exodus per capita of people. So if you're making a business decision, why would you move in to a community that is losing subscribers?
So the challenge is not just coverage and speed, but it's also sort of the marketplace. So is it that...
And affordability.
And affordability.
Yes, absolutely.
Yeah. So is it that the provider's not making any money?
Yes.
Yes.
I see.
ROI
yeah,
is one of the most important variables to providers. If there isn't a business case that warrants being somewhere, then
why be there?
Right.
And so we understand that in a free enterprise market.
Yeah, but, sort of post-pandemic, what used to be, maybe the public perception of having internet or Wi-Fi being, somewhat of a luxury, right? It's now being considered kind of like a utility.
Right.
Right? I mean, it's a utility in the eyes of agencies like the Corporation Commission.
So if it's necessary utility.
Right. Well,
Absolutely.
if it's a necessary utility, then what is the role of the local government or state government in ensuring that utility is accessible and affordable, as we do with water and as we do with electricity?
Because it's just not thought of like that yet.
Working on it.
And that's part of our conversations, right?
Mm-hmm.
Well, do you think that if the pandemic hadn't happened, we would be as far as we are in terms of those conversations?
No. But I don't want to say that because I don't want to take something good out of something bad. I just fundamentally, but you're right.
And in the education world, I've heard this said a million times by practitioners that the pandemic was a real eye-opening experience because it demonstrated the gaps that existed that you wouldn't have seen had you not tested the system in the way that you did, right?
Right.
So I don't
sort of.
I'm not saying that the pandemic is a good thing. I'm just saying, and has that shifted because of it?
In parts, but we always knew that. Like we knew in our region that was an issue. We knew that with schools before the pandemic. We knew that in the court systems. Right? Because things had moved to a court and they don't have access. Mm-hmm. So we knew that in lots of realms. It took the pandemic, I guess, for other people to realize that.
Sure. I mean, the conversation has been ongoing for a very long time. You all know that this is not new. It took the pandemic to sort of crack open and shine a light on things that were being exacerbated. And so when you have whole groups of kids across the whole of a state, across the whole of a country, it's a much different conversation than when you can say we have a few folks who don't have access. Same thing with access to healthcare, right? For a whole group of people, not being able to reach their doctor has tremendous negative health outcomes. And we think of broadband, and you all think of broadband as a super social determinant of health. So without it, your well-being and health more broadly isn't as good. So we know that to be the case. So it's the moment, I think, is more about how to make sure that we're elevating the conversation in a way that encourages people in a nonpartisan way, right? Because previously I think I'm going to take us down a rabbit hole here, and I'm going to try not to do it. We knew all of these things were true before. The pandemic made or shone a light, I think is the words that a lot of people like to use, the depth of a problem that was already pretty massive. And then we were watching in real time as the problem was getting worse and worse. And so now we have kids and we're talking about things like learning loss. We know now because of a lack of access to healthcare that people's health declined in a way that it didn't before. We know that, even if you were seeking care for COVID and you couldn't even sign up to go get a shot because you didn't know how to use the systems everything was online. And so all of it sort of transitioned into this place that was more pervasively driven by being online in a way that was part of every aspect of the way that so many people live their lives. And I think it was that and the fact that we were watching in real time an impact to the economy, which is what brings lots of people to the table, right? Because all of it has a component related to ROI. And so when it started to be significantly impactful to people's wallets and pocketbooks, then it changed a conversation because a social impact conversation is not nearly as compelling to lots of folks as an economic impact conversation. And both of them should be had at the same time because they're both equally as important.
Well, an example of one would be healthcare. Because, Mignonne, I think that in your community, you worked on a project where you basically built up telemedicine, right?
Yes.
Because there was just not much access to medical professionals or actual medical services. So maybe that is an example of social impact plus economy. Do you want to talk about that a little bit?
But the other thing is, right, so then we could have providers in the area. But what happened then is for us, and we had resources, for us to get final mile into that building was a nightmare.
We'll talk about that final mile.
That final mile was so cost prohibitive. Had we not had funding to get that in there, we wouldn't have been able to, right? So then we were able to get that funding in there. But I was pretty naive also. Once we got that in, I thought, we're home. This is good. Yeah, there's a monthly bill. There's a monthly bill. And we can afford it as an organization, right? It's $300 for one outlet, $300. How does an everyday citizen afford that? How does someone with a different income level afford that? And so that's where we get to the affordability.
Right.
Erin, we used to talk about that as it related to school systems and getting greater access to broadband and just upping their technology, is they actually did get that final mile through E-rate and enhanced E-rate. But once they got the technology in the house, they did not necessarily have the experts to manage it, the technical training to help their teachers use it. Right. And then, of course, those children who are in these sort of rural, remote areas could only access it at school and not at home.
Exactly.
So there was, even in those sort of success stories of, yes, a school system has, fast internet and they also have network and they can connect. The reality is that the community that surrounds it may not. I remember having a conversation with you that the school had excellent broadband, but she couldn't get anything at the courthouse or something like that. Yep. So, that's, I think, where the equity conversation comes in, right? Because the kiddos who are in those communities don't necessarily have the same educational experience as the kiddos maybe, 5 miles down the road.
And even if you have a household of more than one child, and you're trying to get them all onto the internet. So during COVID, my neighbor's kids would come to the house and use mine because they had 7 children. So how's that going to work?
Right. That's so all of the nuances when we talk about digital equity. So in addition to broadband, right?
Yeah,
digital equity, broadband is included in that. It is sort of like a holistic ecosystem, right? Where broadband is one component of it. It's all of the other things that make possible meaningful engagement, not just do you have access to the internet? Because if you just have access, then here's a paperweight, have at it. That's not really going to get you to a place where you're engaging in the ways that you find valuable for yourself and your family. And so equity is people having everything that they need to meaningfully engage in the ways that matter to them.
So outside of education, let's give me an example of a community impact that would, in probably an underrepresented community where, if there is no access or it's out of the realm of affordability, how would you see that disparity show in like an underrepresented community other than through education, healthcare?
Well, healthcare, but I'm going to come back to the court system. And now being on the governor's state bar, I didn't realize this. You know, you don't know what's not in your lens until you see it through a different lens. And as they talked about trying to make the courts more equitable and being able to provide court through broadband and have virtual court, well, how's that going to work?
How are people going to be able to access it?
Okay, so, and then we're back to Erin's point too. So maybe I'm fortunate enough to have access. I don't really know how to log into the system.
Right.
I don't know. I have my court number, but then I'm supposed to make a phone call and use this at the same time, and I only have one device. How can I have my court appearance? How can I get in touch with my attorney? How do I do anything?
Right. Equity means that the solution fits the person. So it's the right solution for the right person in the right moment. Like that is equity. It's not everybody has this. It's the right thing. So if you have a family of 7, you need a system that is high speed and reliable and affordable enough that every one of you can go online for the things that are important to you, whether that is paying a bill, accessing school, doing work from home, streaming your favorite show, learning to cook online, whatever it is, that should be possible based on you and your unique circumstances. And that's where this whole lens of equity becomes really, really important, because when we narrowly focus on just the one piece of it, or we try to apply solutions that are one thing for everyone, then we will inherently not be successful, because there is no such thing as a one size fits all, and everybody needs or wants to be online in a different way. And I will say that that's kind of one of the places where things have, I don't want to say fallen apart, been less successful. It's because there has been a drive around adoption, and it is because, and then you have people who say, I don't want that schools is a perfect example, right? You had a solution that was part of a school district. They were given a device, just as an example, one-to-one program, fabulous programs. I hope all the schools have them. But the only way that people could connect was into the school's LMS, into the school's ecosystem, which basically meant for families who are part of those vulnerable populations, particularly those that are in the lowest socioeconomic strata. So if their whole family just had that one device, and that device came home from the school, the only thing that they could do is access the school, is access homework. So it wasn't an equitable solution, because nobody else in the family could actually use the computer.
They couldn't use it to have the groceries delivered. They couldn't have it to pay their bills. They couldn't, all of these. Yes, I see.
Right. And that's problematic.
Yeah, it is. And it just occurred to me when you talked about your mom, my mom's pacemaker reports back through her Wi-Fi.
Yep.
And it's a little bit daunting to think that, it's not about, can you access the Phoenix Library to look at a book or to do school. You're talking about life and death situations. We as a society have allowed ourselves to become dependent on this for the sake of efficiency and modern progress and being able to, medical innovation. But at the end of the day, my mom lived where your mom lives, and she had her pacemaker or whatever it is, and the internet provider said, see ya, wouldn't want to be ya.
Yeah.
Yep.
She'd have to move because how else would
And that's with my neighbor. That's exactly how she has the pacemaker. It's the same thing. And she came over to me not knowing why it didn't work. And so they're all the things, again, until you hear the story, you don't realize all the consequences.
I think that, for people who live in these sort of metropolitan areas like me, and, their Wi-Fi goes out in the middle of the day and they start pulling their hair out. There's just not a relativity to other people's experiences 500 miles away or 1,000, even maybe sometimes 100 miles away.
You'd be shocked how many people in Metro Phoenix don't have the internet.
You would be. And I hear that and I'm like, okay, and so of course me being me, and I'm like, okay, I know you don't, but you know what? If you just went across the street or you went somewhere else, you would have it. We don't have that option. So yes, you're absolutely right. This is
Yes.
back to equity,
But
right?
that's the equity.
Right.
What you're
Yeah,
saying
exactly.
is it has
The
to
equity.
fit the
Yep,
person.
exactly.
And that makes the assumption that the person
can leave the house.
Exactly, that there is transportation, that all the other things are equal, and they are not often. And so you
Exactly.
have people and it's quite often just because they're poor, which is even more problematic. That gets into all these other conversations that are challenging and nuanced conversations. But it shouldn't be that just because you happen to live in an urban area that you are less deserving of those systems that enable equity across the board. So it should be that a solution is relevant and the right fit for someone in rural Arizona, in Cochise County, because that's the solution that they need. And we need to account for all of these variables to get to that equity. It might be fewer variables in an urban space, but it is all understanding the needs of individual humans and communities and then creating responsive solutions that meet those needs.
And that's the hard thing about Arizona, right?
Meh.
We want to roll out one plan. We want to roll out one plan that's going to work for everyone. And it just isn't going to happen that way.
Or we do what we've done throughout history when we get, in this case, $1 billion from the federal government.
Yeah.
How much is it?
So there's two different plans,
Right.
And I think it's
Phase
one of
one
the
and phase two, yeah.
more than that. It's really important that we talk about broadband, which is BEAD, right? So
Broadband, equity, access, and deployment.
correct,
Yep.
and then additionally, there is the digital equity plan dollars, which is significantly smaller. We still don't know what they are, but that's I will pull a shameless plug here. That's the stuff that relates to helping the humans. I mean, broadband is all about connectivity. It is, there are nuances about how that connectivity will exist, and what kinds of organizations are eligible in all of those
Infrastructure.
things. Correct. But the digital equity dollars are everything else that the humans need to meaningfully engage. And that I keep saying meaningful because that's the goal. It's not just, you can do something. It's meaningful as determined by the person who's using it. And that is another bucket of money. And I continue to advocate for that bucket growing exponentially, because it is, you can have access, but unless you've been supported in growing your confidence, your comfort, there's ecosystem supports, there's skill building, there's 21st century this and that. I mean, all of it is really important, and it can't just be $1 billion over here.
So when we got the ARPA money and all of the sort of pandemic money, it was all in buckets, and, $400 million goes to the locals, $300 million, stays at the state, and everybody did their thing. When we think about broadband, at least the way I think about it, if you're getting this $1 billion plus, are we going to allocate money in that way? Because if we are, there's not going to be any connectivity to the connectivity, right? Which, I champion of rural Arizona, you still need an urban center that is functioning as well, and vice versa. So my question is, this $1 billion, does it come with a requirement to actually do a needs assessment of the entire state and then use those dollars in a targeted fashion? Or are we just gonna, you get a car and you get a car and you get a car, and hopefully your car and your car and your car all, sort of sit together? Because that's what worries me as someone who's been watching money flow into the state, is that I can't speak to what our outcome and our metrics are going to be and how we're going to measure and leverage those $1 billion across all of our needs.
You can speak for BEAD, I can speak for DE.
Yeah, that's the problem, right? So there's a plan being written. There is one plan being written.
But you guys are doing community conversations. I
so
know you are,
yeah,
so you know what people need.
Here's the problem. Here's the problem for us, is that I come to someone who doesn't know anything. They know there's a pocket of money out there. I know there's a plan out there. And this is what I get. Mignonne, what do we do? How do we weigh in? What do we say? What do we want first? Is it the affordability? Is it the access? What do I do? And so my job in the role, thank you very much, because Erin has me in this role, so I have her to thank for this, is trying to figure out what is the best use of everyone's time. Because there's all these different committees. People are working hard, so don't get me wrong. There's all these working groups. Everyone is working hard. But I think about the people that can't go to any of the meetings, that don't even know what they need, right? Like, I just know I don't get it, but I don't know what else I don't know what I don't know. Right. I just know people are talking about bead money and I want some, but I don't even know what but I don't know what I need.
Right.
And so how do we, through Benton Foundation, how do we put a plan together that works for everyone? And that's the real challenge, is where do we weigh in a meaningful way? Conversations with Erin, like, how do we have these people that are followers and say, we want to help, but we don't know what we're helping? Mm-hmm. That's the dire situation. And there's deadlines to that. Well, there's more than one.
I mean, didn't you say at the beginning, if we go for full circle now, that it's not necessarily that we don't have the money, it's that we don't have providers. It's we don't have providers, but we don't have people that are weighing in that know what they need. It's not just we don't have providers. That's one piece of it. But even if we had the providers, what's the affordability? What is the access to it? Where do we really need it? There's the whole bit about the maps that we haven't even talked about. And a lot of those maps are not even correct. So there's so many issues out there. And for me, what keeps me awake is trying to narrow down, like, what are the 2 or 3 that I can be influential on? That's the hard part. What about you, Erin?
So I can speak for DE, for the digital equity plan stuff. And we're the contractor. So Digital Equity Institute is the contracted entity to support ACA in the design and writing of the state's plan. We did the needs assessment. And it's ongoing. I mean, this will be a thing that has to perpetuate year over year over year. But we went to every county, and you have to go in person. I think that's one of the most important things, because if you're not actually talking to people, or if you're relying on online mechanisms, you have a whole massive group of people who literally don't have the internet. So how would they know that you're doing something? So, leveraging human-centered design and grassroots behavior, to bring people out to engage in conversations. It's the very beginning of trust building, because trust building is one of the most important pieces of this. And it's the part that's going to take the longest. And so, we did 15 stops plus a couple of extra little stops in places that we didn't have large enough participation, and a total of 48 listening sessions all around the state, with community anchors, with community members, paying particular attention to folks from covered populations, who are the folks that are often who are always the marginalized. So like racial and ethnic minorities, veterans, people with disabilities, people in rural, remote, and tribe, people who are aging individuals. We got quite an earful about how we spoke about aging individuals. For example, I call them the wisest of folks, and they seem to like that. But other language like seniors, people were not as receptive to. But we had to learn what the state of play was right now. So what are the experiences that are unique to individuals and communities across the whole of Arizona? And then the plan has to be responsive in a way that is aligned with each community and individual's needs. Otherwise, you will have a plan that doesn't work, and a lot of money poorly spent. And so my hope is that as we put forward a plan, and hopefully everybody understands that it's a starting point. We did what we could over the course of the last year. We got to as many people as we could get to in that time frame, and it certainly is not enough. And it must be a process that's replicated. So the hope is we start where we are. We identify a few things that are commonalities from barriers and challenges and potential solutions, and what members of the community said that they wanted. So we try those things. And so we implement in a way that is well-funded and deeply driven by local folks. And hopefully, if we do that well, we get to a place where we're leveraging solutions that are known to be efficacious, that have already been fully vetted, that are intended to add capacity where capacity challenges exist. But then hopefully we start to build. And if we do it well enough and we're building trust throughout it, and we're engaging the local folks, because they should be the drivers of their own experience. It shouldn't be other people coming in and doing.
Well, and I mean, we could talk a lot more about this. There's so many questions I didn't get to ask, but there is going to be an intersection between the government role in this, and then how do you engage the private sector to work together, because I don't think it's something solely government can do without community engagement, as you described, but also businesses and other nonprofits and organizations.
Can I say one thing about that? Because I think it's really important, and it's among the things that makes me itchy. Like the stuff that I call it itchy because then when you get nervous, it's the stuff that makes me itchy and keeps me up at night. I think previously, and please correct me if I'm wrong, anyone in the room, please feel free. Lots of money gets awarded to government. And sometimes that money isn't as efficiently distributed to.
Erin, none of us work for government.
None
of us is going to get in trouble with government.
So I don't work for the government. But I worry that the government will be recipients of a lot of the dollars. And I don't think that's the best way to spend the money, personally. We had the privilege of meeting a lot of local folks. And people who happen to be part of business industry, NGO, nonprofits, all kinds of folks. And I put academia or higher education and K-12 in this ecosystem as well. I wouldn't necessarily group them as government. I'm thinking more like agencies when I'm thinking of this. For the solutions to actually work, in my opinion, they need to be led by folks who don't sit in those places. And I'm very, very hopeful that as dollars are awarded, that it is those folks who are carrying the torch so that the solutions are more likely to succeed.
Yeah. I mean, that's what I was referring to when I was saying, you get a car, you get a car. Eventually, you're sort of leaving it to these pockets of, and it's generally led by government. So I have to kind of conclude this conversation, which probably could have gone on for another hour, with the question around the Flinn-Brown network. Mm-hmm. So it's not by accident that both of you are sitting here talking about this issue. Number one, you are in the same cohort. You're working on the same issue area. And it's a big one, so don't let me minimize it. But how, leadership is so important in public policy. How does a network of like-minded individuals who are focused on solutions to challenges, how does that network create sort of positive impact as you do your work?
I mean, I think, within our network, you meet people that you want to work with. Mm-hmm. And so when Erin and I first met in our thing, you have connections with people in there, they're trusted sources. Mm-hmm. And we've always said one day we are working together. Like that was just a thing. We knew that we would at some point work together. And I think throughout the time, I've worked with so many of my Flinn Fellows, honestly. Yeah. You call them up first because they're committed. You know that they're in this to make a difference in the state of Arizona and that they're in it selflessly. Mm-hmm. I mean, they truly believe in their cause, and that's who you want to work with at the end of the day.
Yeah. Well, it's been 10 years since you guys were in that academy together and doing two different things at the time. Oh, yeah. Mm-hmm. But now that your network has grown and the access to leaders in the public sector, the private sector, and then just being able to work together is really exciting.
It's really cool.
It's fabulous.
It's so much fun.
So I want to thank you both for being here. This conversation went way too fast and we could have talked way more. But I hope that, everyone recognizes, there are some foundational issues to all the work that we do in education, healthcare, criminal justice. And at the end of the day, that sort of access to information in the 21st century that comes via these digital mediums. Yes. And if people don't have access to information, they are not informed, they are not educated, they are not able to participate fully in their own democracy. Mm-hmm. Yeah. And I'm not just talking about voting or anything like that. I'm just talking about being engaged citizens.
Absolutely.
And so this is why this issue sort of rose to a more important level in my mind, because ultimately, access to information is what empowers communities and at the end of the day fosters that economic growth that fuels a vibrant society. So thank you to Dr. Carr-Jordan and Mignonne for being here.
Thank you so much.
It's been great. Thank you.
Thank you so much. This was a blast.
Yeah.
Appreciate it.
Thank you.
That wraps up this episode of Leadership Forward. You can find out more about the work of the Arizona Center for Civic Leadership at our website, azcivicleadership.org.